I'm Dr. Dowtin, president and founder of Playfully Psyched. So very excited to have you here today. We're going to talk a little bit about Dr. Owens and adultification. So stay tuned. Hi, welcome, Dr. Owens. Thanks so much for joining us today.
Thanks for having me. I'm excited to see where it goes.
I know, right? Today we're going to be talking a lot about adultification, and specifically in the Black community. We wanted to have this conversation because it's actually something that Dr. Owens and I have talked about many times, and something that I'm always talking about on all my platforms. So if you've heard me speak before, you've probably heard this topic a bit, but I thought it'd be really good for us to talk about it publicly so you can kind of see where we're thinking about this from two different perspectives within the same field and working with similar populations. So we thought it'd be really great to have this conversation now because we see it everywhere. We see the impact of adultification everywhere throughout our society, and then throughout families and homes, hospitals, you name it, schools, it's happening. So, okay, adultification. So basically, adultification is a nice, big, fancy, multi-syllable word to discuss, right? Adultification, right? Nice long word. Tells that when we see a child, right, we put adult behaviors and beliefs onto that child. So we see that child more adult-like, which then leads us to believe that that child should have the same types of treatment and AKA punishments that we would put on an adult or even a child that's much older. So it could be something like seeing a 3-year-old and believing that that 3-year-old knows what they're doing, as an adult would know. And so then that 3-year-old is then going to be yelled at, punished, grounded, or whatever the case may be, the same as you would maybe a 17-year-old or a 25-year-old, or very similar to that. So seeing this child is older than they actually are. So we adultify them, or we make them more adult-like. So that's like the basic definition. Is there something you wanted to add to that, Dr. Owens?
No, I think that's a great description. I just started thinking like a lot of examples, which I know we'll get to more later. So
yes, we're gonna have you roll in those examples. That'll be so helpful. One of the things about adultification is one of the, I think, sad things about adultification. All of it's sad. What am I talking about? But one of the sad things about adultification is that it is rampant, really prevalent in the Black community specifically. There also is evidence that shows that it happens within Latinx community, indigenous populations, basically populations that have children of darker skin tones, of really dark skin tones. People tend to put these adult-like behaviors or adultification on these children. And then it has such long-lasting outcomes. So not just the outcomes that are happening in these like early points of childhood, but lifelong, and we're going to get into it later, even generationally has impacts. So why don't we start there? Think about some of the factors that lead to adultification of Black children. I'm gonna let you start, Dr. Owens.
Yeah, I think there's so much that goes into it, right? That speaking about generationally, I think this starts way back, probably like in slavery, where how children had to take on certain roles and responsibilities at such a young age and being required to do so much. And I think in our time, like just kind of fast forwarding now, we have parents who see their child as being older. And so like, I want to say in some ways it comes from like when families have like a lot of kids, like sometimes it's like, I need you to be able to do this now because I have this other child to kind of bring up too. So like children at younger ages get more responsibilities and kind of seen as older in a sense that they can handle it when maybe they're not exactly ready cognitively and physically development.
Somebody out there, I know, rolled their eyes as soon as they heard the SLAVE word, right? At the same time, we have to acknowledge that a lot of things, a lot of these more problematic behaviors and problematic ways of viewing children is rooted in our history within this country of enslaving African people, right? And I think that her name is Dr. DeGrew, who has a book that's called Post-Traumatic Slave Syndrome. And she actually does a wonderful job of talking about how some of the ways that we discipline, that we look at our children, the way we treat our children does come back from those enslaved times. And in some ways it was, it was survival then, right? Like you just talked about, like some, whether it's helping with the family or really staying alive as an enslaved person on, in the field, and passing down some of the ways that enslavers treated us, right? And we had to like keep our children in line. That was survival, and something that during those times needed to happen. Like we can be grateful that those things happen. But now we've shifted to a different time where we may not need to still treat our children in the same way or still look at our children in those ways. And yet that behavior has been passed down generationally, right? And we aren't sure how to break that cycle. We don't know to break
don't know that it's happening, right?
Yeah.
I think there's a huge part of it. As I mentioned before, like if there's a slavery part and then we still see it today, but it's also part of modeling. If you think back to like when you were growing up, how did your parents or your grandparents respond to younger children? And I know, speaking personally, like a lot of the times when I'm interacting with kids, I can hear my aunts or my mom saying certain things. And I'm like, wait, now that I'm more informed, I'm like, that's not okay. Like, oh, wait, I can't believe I thought that before. I'm glad I thought it before I said it, but I'm also like, I can't believe I like was going down that same way. But it's so easy because it's what I've seen all my life, right? And then even in my environment, like even if it wasn't just in the household or in my family, it was what everyone is doing, right? It's like, you can do this. Why didn't you do this? Why did, why would you do it that way? You're like, well, he or she is two, and I don't think they ever knew to do it the first time. So why wouldn't they do it that way? Or why wouldn't they think their slob is fun? Saliva is fun. It's wet. I don't know. But like, so I think that's also a model, action. So we don't know exactly where it came from, but we see, again, generationally passed down.
And I like the part that you said, like, if they're two, how would they have known to do it any differently? It made me think of, something that I used to do that I think that kids still do, kids still do, is I used to draw on the walls when I was a kid, right? It looks like a big piece of paper. We had white walls, right? And I mean, I was trying to be clever because I did try to use yellow, because I thought, you color yellow on paper, it's really hard to see, right? And so I would try to do yellow, and I was just the color, and it wasn't like the whole house, but I like had this little section and just the coloring, whatever. And my mom noticed, but she had definitely a different perspective. She wasn't really mad at me. She did ask like why you did it, but she had probably a more reasonable reaction than I think that most people would have. But she was kind of like, yeah, it does look like a big piece of paper, right? Like I can see, but we still not gonna color on the walls. Like that's not gonna be what's happening. But not everyone can actually think about it from that perspective, because they're trying to like teach their child the right thing to do. They also don't understand that, well, your child you weren't born knowing that coloring on the wall isn't okay, right? That's a social thing. I mean, if we think back to aren't there like hieroglyphics or whatever, paintings on cave walls, right? Like,
yeah, right, and that's where people are living. To tell a story, and usually our drawings are to tell a story, right? This is what we're doing.
So it's like that social piece that people forget, right? That the things that you like, oh, better. How
did you say
this?
Because I never did it, so you never.
I could understand, right?
Right.
Did you use like when we talk about, if we were trying to teach, a 5-year-old about adultification for some reason, we wouldn't necessarily just start off with the word adultification. We just slap out how many syllables that word has. Like that's not age appropriate. right? And so also remembering to break that down a little bit, where, you know, how would a child know differently if they haven't given the appropriate opportunities to learn differently?
Yeah. I think it's also sometimes like parents will say, well, he or she can do this dance or play this sport or do this activity, um, or they did good in some school subject, and it's like, well, then they should understand this, and it's like, but they don't exactly. You know, so many of those things are rote, which means it's just kind of automatic from practice or rehearsal. And it's not necessarily a deep understanding of what's going on. So yeah, the kid knows all the words to that song, probably because they heard it a million times, right? And so they're singing the words to the song. They have no idea. I know that for myself, singing songs as a kid, I just within the last 2 or 3 years learned the real what they were talking about. So it's not. And I was singing this song back when I was 7, 8, 5, I don't know, somewhere, whatever. Right. So it's like, oh, I was singing, I can't believe I was singing about that. And that was my jam, right? Like, so we're doing things automatically and kind of just like rehearse and practice. And we don't really have a deep understanding of stuff. And a lot of kids don't, because of the development of the brain. There's different areas of development, right? And I think that's another thing that can get us caught up too, is just the different areas of development is so tricky for a lot of people to wrap their mind around. Like, yeah.
Yeah, I love that you brought that up, because, you know, you said different areas of development, even of itself. I think when people, you know, say, okay, I have a 2-year-old, right? Then they think that child, I mean, if we're lucky, right, they're going to think that child is 2 across the board. But in actuality, right, so we have language development, we have cognitive development, so that you're built like critical thinking, learning skills, whatever. You have social, emotional development, right? So your social skills and also like your emotional intelligence. You have physical development, which is also broken into like fine motor versus growth motor. So like little tiny muscle skills and like large muscle groups, right?
This versus doing this.
Exactly. Yeah, like doing this.
Doing this. Right. Correction, this way. This drink.
So your pencil grip versus like this, right? Exactly.
Drawing on the walls, right? More appropriate to draw on walls than like a small piece of paper. How do I keep this in here?
Exactly. But people will think like, oh, my child is 2 in all those different areas. So we named 4, and then we broke off at least one of those areas into 2. And language development actually has 2 branches, right? Because it's how you receive information, right? So your receptive language, but then also how you express that language, right? So what comes out. And what people don't realize, and I'm so glad that they're watching right now, is that your child or a child in your life could be a different age, a different point of development for all those areas. So your child might be 2, solidly 2 in fine motor, right? Might be 1.5 for expressive language, right? Might be 3 in receptive language, right? And like we keep going. And so it's very nuanced, and it depends on the child. So what I have found, one of my like biggest pet peeves, and you know, I used to do it, and I probably still do, because we're all human and no one's perfect. But when you hear a child that has really strong expressive language, so they can say long syllable words, right? They seem to be able to talk through their ideas a bit. We assume that they also have the same equal development for their receptive language. And we also assume that they have the same skill set for their cognitive development. So problem solving, thinking things through, critical thinking, right? And that is so often not the case. And we know that there's problematic research, but a lot of the research, you know, suggests that even like little girls, right? When we teach them to be social, we rear them to be social. And we have a component of that social development that's wrapped in language. So often little girls might be talking up a storm, right?
Oh,
Got something, go for it.
The adultification, like,
Bring
because they're saying what they're hearing around them. They don't know what that really means, right? When they're saying like, oh yeah, my boyfriend did this, and you're like, you're 3.
Right.
Do you know what a boyfriend is? You know, and it's like, either they heard it from TV, heard it around them. And so not only is it what is being either directly told to them, right? Like, you're not doing this right. You need to be doing this. You should be doing other XYZ. But they're also just constantly absorbing, because children are sponges. So it's the music, it's the TV, it's the people talking in ear range, right? Where kids are picking up stuff and they're like, oh, this sounds like I should just say it. Like, I should just say this because I heard it, or I'm trying to figure out what that means. So then I'm playing it through my mind, right? And saying it out loud to see. It's kind of like kids play with Play-Doh. And I think a lot of people, frankly, and I don't think if I didn't have a PhD in clinical psychology, I probably wouldn't know this. Like, kids play through their language and through toys, right? And they're acting out. And so, but all of this is to help them better understand their environment. So sometimes when kids say curse words or say things that are not appropriate for children to be saying, that's part of them like using a ball of Play-Doh, going like, what is this? What am I going to make of this? How do I fix this into something? Right. And so I think that also contributes to the adults then responding to what a child might be saying. Right. They're like, oh, well, if they can say all these curse words, they can clean up this whole house or clean up their room or clean, like, well, no, it happens, but not really.
Right.
Sorry, I didn't mean to cut you off, but I was like, oh my God.
No, I love it. Bring it, right? Like, I think that's so important, because you're right. The way that children are using toys, using play, right, to express themselves, to make sense of their environment, to make sense of the world around them. Play helps with role practice and rehearsal, right? Like, who am I? Who are you? What does this mean? Like, how do we interact with each other? All that's happening through play. But when we scold them, right, for practicing or figuring something out, like, that teaches them something too. Everything is a lesson. And I love that you brought up that they're also absorbing information. It's not just what you've directly taught them. And actually what we know, right, Dr. Owens, is that not only is it not just what's directly taught to them, humans don't learn well what's directly taught to them. It's like, I don't know, I'm probably going to get stats wrong. It's like 10, 20 to 30% of what the direct information, the rest we are learning actually through incidental learning. So the things that people aren't saying, right? Yeah. The things that we're seeing, the things that we're overhearing. Incidental learning is the bulk of how we create ourselves, how we become who we are. Yeah. And so the other piece to that is that can be hard when we hear teachers, families, adults say, I told you 1,000,000 times. And
that's supposed to fix it because I watched you do something else. So right. You told me 1,000,000 times. You never showed me exactly how to do it or modeled that that's what's appropriate, right? And so kids are like, you're telling me drink water and all you do is drink soda all day. Like, so that means soda is a thing. I know you told me drink water 1,000,000 times, but that's not, right. That's not what I want to do.
That's not what is being shown. That's the actual thing to do, right? That's not the thing that's going to be rewarded. That's not the thing that's going to gain attention. That's not the thing that's going to gain social acceptance, right? Yeah. And you're showing me this because you're doing something different. And why would I remember actually what you told me if I have 2 to 3 times more examples of something opposite, right? Yeah. We attend to either what's going to be most intense or what's going to be most repetitive, right? And then like with the whole, like, I told you this 1,000,000 times, again, did you tell me that at an age appropriate or developmentally appropriate level?
Did you say it with multiple things on the list?
Right, was it like a snowball list of things for me to remember and not like, and then I tuned you out? Did you actually have my attention? Right? Did you tell me something while I was playing? Because like, I probably not on purpose couldn't get what you were saying while I was like grossly wrapped in my play, like immersed in my play, right? And so how do you know that I actually, just because you said it a million times, maybe I only heard it 3 times, right? Because I was distracted, right? Or not at all. Exactly. The other thing you actually did mention and you touched on was about something becoming automatic. Right. And so I just want to touch in a little bit on the role of unconscious or implicit biases, right? And how that plays a role in adultification. It's something that's unconscious, right? We don't have the cognitive awareness that we have this belief in something, right? That makes it implicit, that makes it unconscious. Bias in itself isn't good or bad, right? Like it's just like we have a bias for something or against something. So like we like something more and we know it or we don't. But when it's implicit, it can drive our behaviors, right? And how we respond. And the reason why this is important within adultification is because when we think about racially, so when we go through and we think about what are some of the common narratives that are said about Black children or Black people, I can even just go to Black people, right?
Yes.
There are so many common unhealthy, negative narratives about Black boys, right? There are ways that we totally erase Black girls, right? We Black children are bad, they baby's kids. They are predators, they're aggressive, they're disrespectful. You got some? You want to roll some out?
Lazy. Yeah, a handful. And I think this is one of the things that I actually learned from Dr. Joy DeGruy. Just how that played a role, right, historically, and trying to downplay the qualities of the child so that they wouldn't be separated from the family. And now it's just kind of implicit for us to say negative things about our children instead of building them up and giving them positive affirmations, right? So instead we're kind of like, oh, they didn't pick up that when I told them to, they're lazy, or they don't listen, even though I may not have used age appropriate language or asked them to do something that they physically could not do. Because again, like that's a different area, right? So you can tell a child to do something, but if they don't have the physical or even the coordination at the time to execute it, then they become so many other names that does not necessarily motivate a person to want to try to do it ever anyway. So yeah.
Yeah, and if you like the part about like I told them to clean up something, the part that I think we also forget is if you're going to give some type of like verbal praise or award or something, when you wait all the way to the end, right? And that end is developmentally beyond what's appropriate for that child, then whereas they can't have motivation to do that because they can't actually achieve the goal. They can't like get the praise. And it makes me think of, a 2 or 3-year-old when people's like, I told them to clean up this stuff. They like dumped all these toys out and told them to clean it all up. And then I might say like, yeah, that's really frustrating. There's so many toys on the floor. There's so much happening. Did you know that like for a 2 or 3-year-old, they can actually only pick up about 8 things before they actually lose their attention? They can't actually focus longer than that, especially by themselves. So sometimes people redirect their attention. We can do this together. But eight things is about all you're going to get, right? So there'll be some children that like, maybe they're going to get 4 or 5 things picked up and that's a success. Right. But, just because you said to clean it all up, all is a concept that might not be possible for them. But again, with that implicit, like I like you talked about Dr. DeGruy, that implicit us not knowing that we carry the belief that, oh, our children are lazy or something like that, right? And that it came from not wanting our babies to get sold off, not wanting our babies to get harshly beaten, right? Wanting our children to look younger than they are, because I know a lot of states that had enslavement laws, some was for children once they were 10, they became sellable. And some it was like 12, but think about the motivation that you have like a 9-year-old and you want to talk down as much as possible. Like, this child is lazy, they're no good. You want to do all these things to try to keep your baby with you, to try to keep your baby from being sold off and never seeing them again. And that was powerful. Like I said, there's sadness, but there's beauty in that too, because of the value that we have within our families, like trying to keep our families together. But it's not serving us now, right? It's harming us now. We need to make the implicit explicit. So we need to take this belief that some of us, that we all have. So none of us are exempt from it.
Not at all.
Because like our societal norm is that these things are true about Black kids. They're not. But that's what society tells us. That's what the news tells us. That's what the media tells us when they villainize us, right? That's what they use to justify, handcuffing 5-year-olds. 5-year-old little Black girls and boys. Like, that's what they do to justify, well, this is a predator, right? And it's like, so we all have that in us, but we have to start to bring that unconscious awareness, and we have to make ourselves aware of it as our first step, because we can't do anything. We can't change anything if we don't even know that we have that core belief. Okay, so this is the fun part, not fun part, but this is the part I know you wanted to give some examples. So let's discuss what adultification looks like at some of those concrete levels. I've been talking for a bit. You want to go first?
Sure. So I can talk more closely to my work environment, right? I work a lot with children and families, mostly in the outpatient clinic setting, but I do have a history of working with people in group homes and doing intensive in-home therapy, supporting families and children with what they call significant behavioral issues. And so, AKA trauma, exactly. That's why I'm like, what they would call significant behavioral issues. And then you get in the house and you're like, oh, okay, so this child is responding to their environment. Got it. So we're gonna just make that note here. So what we're gonna do is focus on how do we, because what a lot of the behaviors that we see in children are a direct response, right? It's either to get or to escape something in their environment. They're not just doing this because they're evil and malicious, right? The children were not necessarily born to be spiteful to their parents. This is all a result of things that they've encountered. And so some of the examples that I can think of that relates to adultification, going back to like the lazy aspect and parents not recognizing the different developmental areas of a child, where there's a kid who is extremely smart and reading above her grade level, 6 years old, reading above her grade level, maybe 2 years above her grade level. And then mom is then more inclined to elaborate on her responses and what she's asking the child to do. And then when she's not able to perform or to do certain things, then mom's calling her lazy, right? She's like, she's just lazy. She can do this. She just doesn't want to. And then that makes kiddo feel bad about herself. But now she feels like she has to say certain things to be accepted in this environment. But it's not that she's reached that ability yet, right? Like her, just because she can read at a certain level, because she's learned how to say these words, even sometimes not knowing what she's reading is coming up. And so it's just like, well, mom, we need to, just address that. I think the other thing that comes up in homes and family a lot too, and even more recently, is a lot of social media. So the influence of the modeling that is done on social media has kids also repeating it, right? So again, they don't really know what it is that they're doing, even down to the dances or saying certain words or things. But then they've got this sass. Everybody knows how to whip their hair and, wants to wear long nails and are clapping and snapping back. And then they're seen as even older. So maybe a 7-year-old is like, oh, I want to do this too, right? And so they oh, why'd you call me at this time with the neck and the, and it's just like, but I don't know. I know that you got this from seeing your mom and your sisters do it, but that's not really where you are at 7 years old, but it's mimicking, right? She's always on social media. So they get to see so much more examples of, and then comparing themselves to. And so then they produce these same behaviors. And then the parent is like, oh, well, if you could do all of these things, counting the list, right? Then you should be able to clean your room, finish your homework, get straight A. Like, and it's like, well, not quite, then the expectations change. Or the classic most frustrating is then sexualized. Well, not the most frustrating, because I think the most frustrating for me is seeing little black and brown children put in handcuffs for having a tantrum. That's the one that I can't. But sexualizing the child, right? So now, oh, do this dance, or assuming or having conversations with kids about being in relationships with the opposite sex and implying that it's the opposite sex for one, and then having this whole kind of dialogue about whenever they have opposite sex friends, right? So now it's like, oh, that must be your boyfriend, and it's like, they're 5. They're 5. Can they just play? And so I think, a lot of people kind of jump to that when they see even 3-year-olds, right? They're like, or babies as infants are born at the same time, and they're like, oh, they're gonna grow up and get married. Whoa. Can they just learn how to hold their bottle first? I don't know. That's my opinion. But, even again, like kind of across the board, having different implicit and kind of biases and ways that we just naturally respond to certain cues. And we don't realize that it's actually not very healthy for that child to be given such gender roles, to be given such strong expectations for for their everything. Because people will say, like, I had a conversation recently where someone said, oh, around 4 months, you'll know what their personality is like. I'm sorry. I definitely pay attention to child development, and I know for sure that you're not. What we're not going to do is say that we know that this child's personality, because you don't know what they're going to be exposed to or how they're going to respond to things. What you do know is how that baby is responding to that environment at that time. Right? How responsive are their parents to them when they cry? How long do they have to cry? How hard is it for them to get their needs met? And then you can say, okay, well now, and it's still even hard. And so what I think professionals in the field will say is like, okay, there's temperament, right? Some babies are easy to please, some babies are slow to warm up. And then it's also, again, how responsive has their environment been that 4 months before the point of looking at them or evaluating them? Or what have they been through, right? Are we taking into consideration them in the womb, the delivery, how much time they spend with their parents immediately after? And to just automatically say, this infant is difficult, that then means every time this baby cries, you're going to say, right, in your mind, again, oh my God, it's crying again. And it's like, it's a baby.
It's a baby. That's communication.
That's the only form of communication they have.
Exactly. To tell you that they need something and they have a need that needs to be met. No, I love that you said that, because you're right. Like, so I work from an attachment perspective, right? So attachment and trauma. And when you work from attachment and trauma, you believe that the environment has such a huge impact on who you become and or not, right? And so it's not that it's instilled in you, like you're just bad from the start. You got this hard temperament, so people wasn't gonna like you because looking at it from a temperament perspective, they'll say like, oh, well, you have a slow to warm temperament, which in those babies who were slow to warm, people didn't want to get to know them, so like dang, so the baby came out not able to have relationships,
never had a chance.
No, that's not the perspective that I work from. That is not the belief that I hold as a professional. And I'm always with the babies, with the pregnant mommies, right? With the parents of newborns, and there is hope. Like I wholeheartedly believe that I've seen it with my own eyes that we can disrupt the transmission of trauma across generations, right? When we hold the belief that change is possible.
Right.
When we hold the belief that your relationship with this child, again, it could be from a parent perspective, it could be adult to child, because I also have a lot of experience in early care settings. So having been a preschool director and an infant care teacher, like that bond is also super important, right? To be able to attachment. It's perfectly okay that you don't have a biological connection with this child, but how you respond to them, how responsive you are to their needs, how safe you can create how safe of an environment you can create for them, that's what helps their development. That's what helps them feel safe. That's what helps them develop into these healthy relationships and have the possibility to develop in other areas. And you talked about even babies, we'll see them, they'll go off and get married. Again, working in infant care, you would see, so we had our rooms divided up by ages. So you'd have the newborns in one room, and they'd be, birth to about 5 months or so. So 6 weeks. The youngest baby would be 6 weeks. So you mean to tell me this 6-month-old baby that we just happened to lay down on the mat next to this other 6-month-old baby, and because they were, we have these gender things. So because one was female, not even gender, but sex, one is female and the other is male, then you already talking about, they're holding hands. They reaching out,
they would hold anything hand.
Yeah, they're trying, little babies flail, right? They're just looking for stuff. They're bodies are jerky, right? They just they have no concept of gender, no concept of romantic relationship, right? They are in sole basic needs: feed me, clothe me, hold me. I
don't even know if they care about the clothing. Just make sure I'm warm, right?
Well, they want to be warm. We don't have to be clothing, right?
Want to be warm. Exactly.
Help me regulate my body temperature because I don't know how to do it yet. That's what it is. I'm hot. I'm cold. That's what it is.
Exactly.
So true. And you brought it up, right? In these early environments, we have, infant care teachers, we have center directors, label babies as, difficult. And that has an impact on how that baby is then treated. And I was an infant care teacher before I ever finished any of my degrees. I had an early childhood education degree or whatever, but before I finished my clinical psych degrees and school psych degrees. And now I look back, I've always had this belief that I would always be give me the difficult baby. I would create the greatest bonds with the difficult babies. I remember one little boy that everyone was he's so difficult. He took his first steps for me, before his parents. And he had been walking for a month, and they were and they had said one day, they're he doesn't walk, and I was like, if he took steps here, would you want to know? I was just just if it happens, would you want to know? And they were yeah, we want to know. So I thought about it. So then another teacher said, well, no, I think he walks for her. I think he takes steps for her. And they were no. So I remember one time, they both dropped off, and they were can you get him to walk for you? Can you show us? And I was yeah, sure, no problem. I got down. I got down, and I called over his name. I was hey, come on over. And he just and they were are you serious? And they were super happy. They're no, we don't care. We're just happy that he's walking, because they were worried that he was super delayed. And I was he just flocked to me, right? Because he was so difficult, but he wasn't difficult. I just created the relationship with him. And again, little brown boy. That's how it can look in the school setting. That's how it could look at home, early care setting. And then the preschool, again, you gave the examples. You talked about them if they're holding hands at 3 years old, how people are their girlfriend, boyfriend, or this and that. It's But adultification, that's the sexualized way. It also has a negative implications in schools, right? And in hospitals, where we are still thinking So it makes me sick to my stomach every time I think about this, but we know that like Black babies are given less anesthesia for surgeries. I know, it's like, let that sink in. Because there's a belief that Black people have thick skin and Black people are stronger. And no one looks at a baby and says, you're anything, right? We usually think of adultification not actually starting until like 3 or 4. But in the medical field, it starts at birth, right? And it doesn't stop, because we also know that like they've done studies on children between the ages of 9 and 16 having like an appendectomy, so having their appendixes removed, also getting less anesthesia, less follow-up pain medication, right? For the same procedures, because we're looking at these like, oh, they're older, they're adults, and they can handle it, and they can take pain.
Why do you just assume you can take pain? I'll tell you why.
I'll tell you why, right?
Because they've had to endure so much pain prior to actually being born in the world. There are people haven't endured so much pain.
Yeah. So they're stronger. Because that also goes back to enslavement, right? Like they put us in the fields and then justified putting us in the fields because we supposedly were genetically predisposed for manual labor. There ain't no gene for that. There's no gene for that. There's no gene that says manual labor is your like what you
should do for a living. Like manual labor. No.
Right. But that idea has passed on for generations, and society puts that onto our children, and it seeps into us and how we believe, right? And what we believe that they're more malicious. We believe that they are lazy. Which is also a contradiction, right? Like we put people out in the field because they are genetically predisposed to work hard, but then you call them lazy. So that's a different conversation we can have.
I think there's Dr. Joy DeGruy also breaks. Well, I know she referenced her source, but she broke it down so well as the way that the racial constructs were developed and the names that they use and how they directly are defined by a bunch of characteristics, and of course the African American, all of the worst names, including lazy, right? Like we got what? I don't even. Yeah.
You did a great job with that. Also, a book that I always recommend to people is Stamped from the Beginning. I think it's Stamped from the Beginning, the definitive history of racist ideas in America, and it's by Dr. Ibram X. Kendi, which I'll put links to these books that we're talking about at the bottom of this posting. Adultification impacts us on so many levels. You have something to say?
Yeah, I think this is kind of like going back to one of like those and then moments, right? Like we were talking about something and we moved on. But this theme is also true for people with developmental disabilities. So it's been documented that they have a delay or don't understand a certain level, and then they are still held to the same. So a lot of, before what we were talking about as far as like adultification for children was just what we would call normal, right? Our typical developing children will develop at different ages across the board. But then you have children who have been diagnosed and recognized as having a developmental disability or developmental delays in certain areas, and then they're still held to the same esteem, to the same expectation as if they were what we would call typical. And so that also becomes really hard, right? Because yes, children with developmental disabilities can still mock and mimic things in their environment and still not have that same deep understanding. And then being punished and treated completely different because they're not doing what you expect them to. And that's implicit, right? It's like, oh, when I see a child being able to do certain behaviors, I expect this. I expect them to also be able to do these other things, and they're not always. And so just, I like that you said earlier, just kind of being aware of what's implicit for us and then how we respond. Yes.
No, that's great. I wanted to add to that, right? It, you know, this their whole intersectionality piece, right? From Dr. Kimberly Crenshaw, and who coined the term intersectionality, which now is like blown up. She coined that like 30 years ago. But this idea that yes, adultification runs rampant in the Black community. Adultification runs rampant in children who have disabilities, developmental delays or developmental disabilities. And so then you would hope that if you have a Black child with a developmental disability, right, that people are like, oh no, okay, no, you're like, you know, like, we're not going to do this to you. Dr. Owens, it happens to them even more. Like, you're even more likely to be adultified if you have if you're Black and have a disability. Like, that should be like, what? You know, you would think that, again, that having a disability, you know, makes you, I would hope, less vulnerable to this, because it makes people like, oh, maybe naturally assume that you can't do things. Maybe in the worst, you know, the other extreme. But no, you still gonna get
regulate yourself. Okay.
No. I mean, we've talked about this. You know, we've talked about this before. I've done different presentations on, like, I've done presentations on little Black girls who have been arrested or put in handcuffs as young as 5 years old. And I do those presentations and those talks because we so often talk about adultification in our community only for Black boys. And so I talk about the erasure of Black girls. Like, the fact that we don't talk about this doesn't mean it doesn't happen. And it actually erases the issue and makes them seem invisible. And they're not invisible. And actually the stats for Black girls is worse a lot of times than it is for Black boys. And then there's like no data on what's happening to our trans children, our non-binary children, right, that are Black. And we know that data has to be hard, because for the adults, it's like, there's really significant negative data on that. But one of the little girls that I talk about, she had a developmental delay. She had a documented disability on her at school, and did not protect her from having the police called on her, you know, in elementary school, did not protect her from actually getting handcuffs, you know, getting put on her, did not protect her from being driven to the police station, right? And did not protect her from the trauma that she still experiences, because I've followed her a little bit. Her mom talks about she has PTSD, she has active PTSD, she still has nightmares. It's been a couple of years since this happened to her. And so I love that you brought that up, right? Having a disability, unfortunately, doesn't make it better, it makes it worse. Being Black and, you know, I call it being Black and, being Black plus, being Black and anything else, right? And life gets worse. Being Black and from any other marginalized community makes it worse. Being Black and a girl, well, there's some things that are going to happen to you. Adultification is going to be put on you. Being Black and having a developmental disability, well, you definitely should have known better. Like, how this doesn't make any sense.
That's going, I think that's a negative correlation. That's actually going the other way. Right. That's not the more you know, the better you know.
Right. It's like, but again, we have these implicit beliefs. And while I know someone said, it's like a meme that went around, and I was like, okay, I get it. But they'll say like, you can't implicit bias training your way out of like racism, or you can't implicit bias training your way out of adultification, right? Meaning, like, I think what they mean by that is you can't take one class. You can't listen to this, viewers and listeners. You can't just watch this one conversation between two Black doctors and think, okay, now I can undo this, right? Like, it's done, because it's insidious. And implicit beliefs are insidious, and they are ingrained in everything that we do and in all parts of our society. So it has to be an active process if you are going to kind of start to flip the narrative and stop putting adultified behaviors onto the children within our communities. I wanted us to talk about the mental health impact of adultification.
Yeah. I think one thing that kind of comes to mind immediately, well, I guess two things. There's first trauma, and then two, the internalized responses, right? So what a child hears or how they're treated, they internalize and treat themselves that way, right? So now I'm not good enough. Now I don't treat myself right. I can't do hard things. I'm not capable. I'm not able to do anything really because I can't do anything right. Just so like all of this negative kind of reaction to themselves. Now they don't like themselves unless they present a certain kind of way, and not being able to really accept themselves as they are or their own interests, right? Because if the kid is being punished for having an interest in Barney at 5, why you still like Barney? You need to be watching this, or like changing what they're exposed to. Then they're like, oh, what my interests aren't acceptable, right? My decisions, my judgment is not correct. And so I can't trust what I'm doing. So now I'm more reliant on what other people are doing, or kind of leaning more in for acceptance. And you may also see that kind of yearn for acceptance from other people, kind of reaching out or doing more kind of extreme things, right? Because it's not about me, it's about pleasing or getting acceptance from other people. Then there's also the externalizing behavior. Well, if I can't do anything right, I won't do anything at all. Now I'm what someone would say oppositional. I'm not listening to what you have to say because you always tell me negative stuff. Like, it's not because I don't want to listen, it's because no matter what I do, I get it wrong. I think like those are the more immediate ones. And I'll just circle back to the notice of trauma. Sometimes when children are, I know corporal punishment is still present. It's not erased and it's still very much used, right? And so when children are physically punished for spankings, popped, punched, hit, whatever kind of reaction parents give to their kid, throwing things at them, stop touching that, don't do that, then that kind of, there's an increased fear that comes with any action. Right now, I don't think I should move or touch or do anything because I'm not sure what's going to happen. So I think one of the things that's really important is how are we responding to our implicit bias? What does that make us do to this child? Because what you say can impact them psychologically, emotionally. What you do will impact them again, psychologically and emotionally, but also physically. And attaching that fear of consequence definitely has lasting impact for them. I'll just really, really quickly note, so in that area of mental health, I also have started working with adults now, and part of it is processing their trauma from childhood, because there was the adultification in the home from her mom, and then there's adultification from the systems that she inevitably went through because of bad decisions later, but not because she wanted to, because of the experiences that she had. But what happens later is that she's like, oh, wait, I never even really had a chance, right? And so I've hated myself and I was angry because I thought I was doing something wrong and I couldn't figure out what it was about me that was wrong, but it wasn't. It was how her environment impacted her. It's definitely trauma, but what the field would then label as an adult is depression or anxiety, increased or generalized anxiety. So we definitely see how it kind of grows. And they just like, I don't know, for some reason people feel like they just have to take the cap off of trauma. I don't agree with this. And I'm like, you're definitely carrying a lot of trauma, and I can't really, I don't want to see all of this other stuff without looking at the trauma. But I think one of the things that the field is still working through is we can't just see this person as being depressed or anxious if they have all of these things in their childhood and their history.
Yeah, no, I definitely agree. You went so many places with that, and I want to like catch on all of them. We're gonna have to come back to that. So do y'all already like this conversation can't just be a one and done, because there's so many things that I was like, I want to say this, and I want to say this, and I don't want to. I cut people off, and I'm trying not to do that as much. One of the things I wanted to say, when an adult comes to me for therapy, and even when they think like they're coming to me because whatever, I'm anxious about work sucking, I don't know. When we kind of go through that history, that intake process, and I learn more about them, I start to view them, and you're laughing because you've heard me say this a million times, but like, I view them as this 4-year-old, like traumatized child, right?
Mm-hmm.
And so, and it helps me, one, with a layer of empathy that I think, unfortunately, is often missing in our field. Something that we don't talk about, as therapists, as mental health professionals, as psychotherapists, is that, people who work from certain theoretical orientations, I'm not going to put them on blast, but certain ones, right, that like maybe are more manualized and they're like looking through these books. The idea of empathy kind of gets lost in the message, and like that you have to do that. But when I can look across you, and I can do it right now, right? Even if you're not traumatized, so I can look at you and I can see like the 4-year-old version of you, whom I've never met, right? But that helps me start to peel back the layers of the years of adultification that you've experienced. It's almost like a reversal of the process, right? Because then I'm engaging in this relationship with you with an understanding that there were things that you experienced that weren't your fault. There were ways in which you behaved that you had no other recourse, right? And all that's okay. And I'm accepting of all those things of you. And again, that's that attachment piece. That's us formulating a relationship that is trying to undo the years and generations of adultification. Unfortunately, I have not met a person that came to me that didn't have a trauma. I've not met an adult person that came to me and it wasn't a trauma. And the overwhelming majority of them, that trauma can be like, we can trace back most of the problems that they're having in today in the present to the instances in their past. And we say like trauma, it makes people think like it's one incident. Most of the time it's like not one incident, right? And most of the time it's like years of incidents. Sometimes it's one like really intense emotional experience, but often it's like they were raised in a traumatic environment, or they had several traumatic events that happened to them, early childhood adverse experiences. What could people do to see their children in their lives as children instead of adults?
One of the things that comes to mind for me, I had a personal experience, and it was just like hearing someone else say, oh, that child is going to be spoiled, or they're going to be a handful, even before they were old enough to do anything, was kind of like a realization, like a eye opener for me. Like, okay, so I don't want to say those things, right? And I want to be mindful of things that I'm saying about someone before I say them. And so I think one of the things that all adults that interact with children, and many times with other adults, right, is this like, why am I using this label? If you can, catch yourself before calling, especially a child, because in this case, this is what we're focusing on, but if you can catch yourself before you call a child a specific label, that would be super helpful, right? Or even just kind of reflecting. Sometimes we just going through our day so fast, we don't realize what's happening. But if maybe when you feel frustrated or annoyed with something, just kind of asking yourself, like, what is it about the situation that's frustrating me? And if the answer is they knew better, right, or they knew they should not have done that, then you can kind of take that answer and say, okay, wait, how old is this child? What? And so I guess it's really just wanting to do better for our next generations. And so by doing that, you're challenging I'm challenging whoever is up to the challenge to ask yourself questions. If something that a child is doing is frustrating you, it's a great time to reflect on it, journal, write it down.
My first thing is you need to take a pause.
Walk
away. We respond out of an intense emotion. We are actually not responding in a clear mind, right? So no, well said, Dr. Owens. Yes, well said. All right, so we're gonna go ahead and wrap up. So Dr. Owens, tell me and the viewers or listeners, like how can they contact you?
Find me on Instagram at Dr. Purple Owens, and this is Dr. Purple Owens, no spaces, spelled just as they sound.
Okay, I just so enjoyed speaking about this with you, and so glad that we got a chance to record it instead of just having it with the two of us. And so it can possibly help many people who watch this over the years.
Yes.
Thank you so much for joining me today.
Thank you for having me, and thank you all for watching.
Yes, thank you all so much.